Hi, welcome back to my channel. In this video, I will be talking about the parasympathetic ganglions in an easy way. So, first of all, before starting, you should know that we have four parasympathetic ganglions. So, starting from the first one, which is our ciliary ganglion, then second is our otic ganglion, then I'll just write it. Third one is our uh, pterygopalatine ganglion, and then we have the fifth one, which is our fourth one, sorry, which is the submandibular ganglion. All right, so submandibular ganglion. So let's start from the ciliary ganglion. Now, ciliary ganglion, the sensory root is the nasociliary nerve. Then the sympathetic is plexus around ophthalmic artery. All right, and secretomotor, you have to remember that it starts from the in secretomotor you just leave it, and in motor you remember that there is an Edwinger Westphal nucleus. Also, it supplies the ciliaris and sphincter pupillae muscle, and here they go around to supply the inferior oblique. All right, now let's talk about the uh, otic ganglion. Now, in otic ganglion, you have to know that the sensory is the auriculotemporal nerve, and sympathetic is the plexus around middle meningeal artery. In secretomotor, you have to remember the whole pathway of starting from inferior salivatory nucleus. Alright, then coming on to the motor, it is the branch to or nerve to medial pterygoid muscle. Alright, and distribution, it basically supplies the parotid gland, tensor villi palatini, and tensor tympani. So this is the distribution part. Now coming on to the pterygopalatine ganglion. In this, the sensory supply is by maxillary nerve, then plexus around internal carotid artery. Then here you have superior salivatory nucleus. Alright, then motor, then here Sida you have the supply of the nose, paranasal, sinus, and so on. In submandibular ganglion, sorry. So here you have the lingual nerve as sensory root. Then this is plexus around facial artery. Here again you have superior salivatory nucleus, and obviously it's going to supply our submandibular, sublingual, and anterior lingual gland. Now usually like this is done, so this is easy. Then there is the question that they ask is this one, which I'll just tell. So they usually ask the topographic and functional variants. So topographical and functional. Alright, and here we have the ganglion. So starting from the most asked one, which is our otic ganglion. Now for otic, you have to remember mandibular nerve, and we have the greater petrosal nerve. Alright, then in second one, you have to remember we have the submandibular ganglion. In submandibular ganglion, you have to remember the lingual nerve and the facial nerve. Alright, then we have the pterygopalatine ganglion. In pterygopalatine ganglion, third, pterygopalatine ganglion. In this, you have to remember facial nerve and the maxillary nerve. So this completes our parasympathetic ganglions. If you like the